Today we're going to talk about the top 6 supplements to treat adult acne and the doses you need to take. Let's get into it. Acne is a complicated condition, but it's thought that there are 4 main factors that contribute to acne. These are excess sebum production. Sebum is an oily substance found on the skin. Clogged pores from sebum and dead skin cells, imbalance of bacteria on the skin, and inflammation. Vitamin B5 is a water-soluble B vitamin, which is needed for breaking down fats and carbohydrates into energy, as well as for red blood cell production and regulating cortisol in your adrenal glands. It's also been found to be able to hold moisture in the skin, thereby softening it and keeping it from drying out. In a 12-week study, they found there to be a 67% reduction in acne lesions after taking high doses of pantothenic acid. So this is how it works. Vitamin B5 is broken down and converted into a substance called coenzyme A. Coenzyme A helps to break down the excess oil from the skin oil glands, thereby reducing the amount of oil able to clog the pores. It may also be effective due to its role in stress regulation. The dosage used in the study was 2,200 mg per day. The most common strength of vitamin B5 supplements is 500 mg. So I'd recommend taking 2 500 mg tablets in the morning and 2 500 mg tablets at night. Keep in mind that the 2 studies with the best evidence used a product called Pantothenic, which had the high doses of pantothenic acid, but also included a few other ingredients at low doses. You may see improvements within 4 to 6 weeks, but you should take it for at least 12 weeks to see if it works for you. Now, toxicity is very rare as pantothenic acid is water soluble. Possible side effects of very high doses, which is usually over 10 grams a day, include stomach upset or diarrhea. It will also make your urine very yellow. You can also easily get vitamin B5 in your diet in foods, since it is found in almost all plant and meat sources. Zinc is the second most common mineral in the body and is needed for enzyme reactions, immune health, protein production, and DNA synthesis. Zinc can be found both topically and orally for acne, but topical forms have mainly been found to be effective when using with other topical prescription acne creams containing antibiotics such as clindamycin and erythromycin. Here's what the studies showed of oral zinc. Zinc taken for 3 months on mild to moderate acne found that 79% of patients had 80 to 100% improvement in their acne. Now, we don't know exactly the reason why zinc works on acne, but it is thought to be due to its anti-inflammatory activity and topically can inhibit C. acnes. This is the main bacteria that causes acne. It may also work by reducing the conversion of testosterone to DHT, which is the hormone that stimulates sebum production. The dosage I'd recommend for acne is 30 mg per day of elemental zinc. Take it for at least 12 weeks to see if it works for you. Don't take more than 40 mg per day unless advised by the doctor. Too much zinc can cause side effects such as nausea, vomiting, loss of appetite, diarrhea, stomach pain, fatigue, and headaches. Too much zinc can also affect your copper and iron levels, which can have detrimental effects on the body. Since your body can't make zinc, you need to get it either from food or supplements. Foods high in zinc include oysters, meat such as beef and chicken, fish, seafood, eggs, and dairy products. If you're vegan, you can get it from other less absorbed sources such as beans, nuts, and whole grains. It's been found that those with severe acne often have low vitamin D levels. Vitamin D has inflammatory properties, which is why it can help to improve acne, and it's also linked to your immune health. The general supplemental dose is 1,000 IU per day, but this will vary depending on the results of your blood test. Be aware that too much vitamin D can affect your hormones and possibly cause acne. So the key is to maintain optimal levels. Not too much, not too little. You can also get vitamin D from the sun and in smaller amount in foods such as fatty fish, fish liver oils, beef liver, certain mushrooms, and vitamin D fortified foods. DIM, which is short for dindolylmethane, is a compound found in some vegetables, particularly cruciferous vegetables, such as cabbage, broccoli, Brussels sprouts, and cauliflower. DIM has been found to act on the body in a few ways. One, as an androgen receptor blocker. In a way, it works similar to the prescription medications spironolactone and cyproterone, which are androgen receptor blockers used in women to help with hormonal acne. DIM helps to convert more potent forms of estrogen to less potent forms. At lower doses, DIM prevents the conversion of hormones such as testosterone into estrogen by blocking the enzyme aromatase. It can help to slow down the growth of C. acnes. All of this helps to decrease sebum production and reduce acne. Common doses in supplements range from 100 to 200 mg per day. Anything over 300 mg can potentially cause side effects, such as stomach upset and darkening of the urine. However, no serious side effects have been found. Improvements can appear within a few days, but give it at least a month to see results. You need to be careful taking DIM supplements if you're on hormone therapy or have hormone-sensitive cancers. You can get DIM from food sources such as cruciferous vegetables. However, you would have to eat about half to 1 kilo to get the same benefits as supplements. There has been found to be a decreased microbiome in acne patients. Probiotics have been found to inhibit C. acnes, have an effect on insulin sensitivity, inflammation and gut health, which all play a factor in acne. Probiotics are not only important to improve your acne, but is also important to help maintain skin barrier by increasing ceramides, promoting collagen and reducing water loss. If you are using any oral or topical acne medications, such as benzoyl peroxide, retinoids or antibiotics, some common side effects include dryness of the skin and irritation. Probiotics can prevent and improve these adverse effects. As there are hundreds of thousands of different strains of probiotics, it's hard to pinpoint exactly which ones you should be taking. Lactobacillus and bifidobacteria are the strains you should be looking for when you're looking for a probiotic for acne. It's better to look for an acne-specific formulation and choose one with either an enteric coating or one where the bacteria has been proven to stay alive until it reaches the gut. You can also get probiotics from foods such as yogurt, kimchi, kefir, sauerkraut, miso and kombucha. Now I'm going to include this one, but studies have only looked at vitamin C applied topically for acne. Vitamin C has anti-inflammatory and antioxidant effects and has been found to reduce the redness and inflammation from acne lesions. It can also help with acne scars and dark spots caused by acne. So particularly if you have a combination of all these three, I would definitely recommend applying a topical vitamin C product. It can take up to 3 months to see results. And did you know that researchers have found consuming a diet high in sugar and dairy can trigger acne and make it worse?